For the past 3 Saturdays, a small but noisy cluster of anti-lockdown protesters has taken to the South Lawn at Queen's Park. Prominent among them, deniers of other sorts, notably vaccine deniers, looking to get their message out. With us to figure out what drives such a mindset, we welcome, in Edmonton, Alberta, Timothy Caulfield, Canada Research Chair in Health Law and Policy at the University of Alberta, and the author of The Vaccine Picture. In Denver, Colorado, Jennifer Reich, Professor of Sociology at the University of Colorado, Denver, and author of Calling the Shots: Why Parents Reject Vaccines. And in downtown Toronto, Dr. Samantha Hill, the just newly installed president of the Ontario Medical Association, for which we congratulate her, we think. We shall see. Dr. Hill, welcome. And to you other two, nice to have you aboard. Timothy, I want to start with you because let's just hit this right off the top. There has been a video, it's about a half an hour long, that has gone absolutely viral, called The Plandemic. And it is said to be one of the most sort of conspiratorial and widespread uses of misinformation that is on the web today, so much so that a couple of social media sites have taken it down. What's the message that the video is trying to convey?
It's infuriating. I don't know if you suffered through it, Steve. I actually watched it.
I sure did.
Every 30 seconds, there's something enraging in that video. It has a lot of the classic conspiracy theories about big pharma, about where the virus came from, the idea that it was manufactured, and yes, it has a lot of really classic anti-vax rhetoric, and this kind of stuff, these kinds of conspiracy theories, take off for a bunch of reasons. We're at a time. There's a lot of uncertainty right now. There's fear. People are looking for answers. And a video like this, especially when it's produced so convincingly and the expert, uses data and scientific language so convincingly, can have a very big impact. It can be quite attractive. And I think that's exactly what is happening right now.
Well, and Jennifer, it's hosted by a guy who looks very sincere and really brings like puppy dog eyes to his reaction shots whenever the protagonist of the thing, says something particularly of concern. But we do need to ask this question because we all believe in free speech here. Are you sure that the information in the video is factually incorrect?
Yeah, thanks for having me this morning. And, there's a lot of examples online already. A lot of scientists have taken this apart statement by statement. There's a lot of ways this has been fact checked extensively. And I would definitely recommend people take a look at that. What's challenging in situations like this is that it feels like it could be true emotionally. And at a time when a lot of people don't personally know anyone who has died of COVID, at a time when there's not a great sense of what the role of government should be or can be in solving problems, more so I'd say in the US than Canada, but we can see this across the world. There's a lot of sense of anxiety, and videos like this start to provide answers in ways that are uncertain.
So for those who haven't seen it, I'll just throw one allegation out there, Jennifer, and you can follow up on this.
Yeah.
So I'm on solid ground in saying you do not believe that Dr. Anthony Fauci is hoping that everybody gets sick so that he can come up with a vaccine and make $1 billion through his associations with Big Pharma.
Correct. And it's challenging for, I think, most of us outside of science to understand how it is pharmaceutical products and vaccines become licensed. There's absolutely in lots of situations where science originates with public funding and then is handed to corporations who are able to continue testing or manufacturing it, and then it comes back to the government for licensing. And that relationship, where there's sometimes for someone like Anthony Fauci, decades and decades of relationships with scientific leaders across different corporations and sectors, it can feel like that's a close relationship. And sometimes that's really good for cooperation, but it can also raise anxieties for people about how well there's really scrutiny and evaluation of that relationship and of the products that get created, which the American and Canadian and global citizens are relying on for solutions to big health problems right now.
Well, Samantha, let me ask you about one of your experiences. You had a close encounter not too long ago with the so-called vaccine hesitant community. How did that go?
So that was a really interesting experience. This was one of my first engagements, so to speak, with the Ontario Medical Association. And I gave a deputation to the City Council in the context of vaccines and the discussion about whether or not to make them mandatory. And I was honestly surprised by the vehemence with which I was met at that meeting. It was quite interesting to me. I walked in as a reasonably fresh off the block media person to answer some questions about vaccines, which to me were self-evident. Really, I wasn't quite sure why I was there, and was met with a large group of people who were really, really worried and really scared. And it's very easy as a physician sometimes to know that you have the right answers and to discount what some other people might be thinking. And I really took the challenge upon myself that day to try and understand where they were coming from, because these weren't bad people. These weren't people who were dumb, for lack of a better word, or anything like that. These were smart, engaged, well-spoken, eloquent people who were very passionate about something, and they were scared. They were downright scared. And as a physician, that's terrifying. When we know that vaccines are one of the safest, most effective interventions in the history of medicine, to be met with that level of fear and anxiety from public people, that had me step back a little bit and do some thinking.
So follow up on that. Why is vaccine hesitancy such a thing right now?
Well, I don't know that it's actually more of a thing right now than it has been over the last decade. The data from at least the Ontario Medical Association seems to show that it's pretty consistent. What we're seeing is about 20%, 25% in the US of resistant or hesitant, however you want to phrase it, people who don't follow the schedule as the guidelines suggest. And the idea that there's scrutiny and that there's individual choice and there's autonomy is very important to medicine. It's very important in that relationship between physicians and patients that we engage at a level where both people are partners in that decision-making process. Where that seems to fall apart a little bit is when the sources of information aren't necessarily vetted, and where the sources of information may have a lot of emotional play, but not a lot of scientific validity. And in that context, which is where we find ourselves with the vaccine hesitant population, you're trying to engage on a scientific level against an emotional argument. And that's really important because we know that we need about 70 or 80% of the population to be immunized in order to get herd immunity.
Timothy, let me follow up with you on this angle, because Dr. Hill's quite right. I saw the survey myself not too long ago, which showed in America, it's 20 to 25% of people who are vaccine hesitant or skeptical, or however you want to describe it. What do we think the numbers are in Canada?
Well, there's been a lot of research on this, and Samantha's right. It's about 20 to 30% of Canadians have some degree of hesitancy, and we have to be careful not to. They're a diverse group. Many people have this hesitancy for different reasons, but those numbers are pretty high. There is some indication that the level of hesitancy is increasing in Canada, and certainly around the world. That's reflected in the things like the measles outbreaks that we have seen. There's also been an increase, and some studies have shown this, in people seeking an exemption from having to get a vaccine. So that is also troubling. There was a study that was done by a colleague of mine from Carleton, Josh Greenberg, who found that about 28% of Canadian parents are vaccination hesitant or have some degree of hesitancy because of the autism myth, which is incredibly frustrating, that this basically a lie continues to have an impact on how people think about vaccines. And lastly, a more recent study, one that came out just last year, found that over 30% of Canadians had some degree of worry about the science. They were uncertain. They believe the science around vaccines continues to be uncertain. So you see those numbers, and you can see why there is concern that even when we come out with a COVID vaccine, it isn't going to be uptake. And by the way, there has been some recent studies, and we have to be careful because this is preprint research, that show that people have said their intention is not to get the COVID vaccine, anywhere between 20 and 25%. And this is a mix between Canadian and US numbers. Some have put it higher. We have to wait and see how that actually plays out. But bottom line, we should be worried.
And Jennifer, what would the implications of literally a quarter of the population refusing to take the vaccine be?
To unwind it a little bit first, we know for 100 years, there have always been a very small number of people who will always be unpersuaded that vaccines are ever safe or ever necessary. And that's probably a group that's entirely unpersuadable. But at a herd immunity level, all communities can absorb 2% of the population who don't want to participate in public health and still safely continue to operate. What's challenging, as my colleagues have mentioned, is that we're seeing hesitant levels that are starting to break through what we would need for herd immunity. So when we get to 20, 25, 30% of the population, those are not people who would identify as anti-vaccine. They would not tell you they don't believe in the science. They would not tell you that vaccines never work or are never necessary. What I hear in my research is that they don't want them right now as they're recommended for their children in the way that agencies say is most effective and safest. And that's not surprising in a lot of ways, because we've really asked people to take personal responsibility for their health. We've asked parents to be entirely personally responsible for their children, to make perfect decisions about all consumption decisions, whether it's food or exercise or opportunities. And so we're at this moment right now where most people don't see vaccines as part of a public health campaign. They really see them as a consumption item that you get to personally choose whether you will personally benefit from it. And the risk we're running, I think, in thinking about vaccines that way is that, one, we never know how any infectious disease will affect any one person. We just know the statistical probabilities of different groups being affected. So with something like COVID, we know that seniors are most likely to be most devastated by infection, but we have lots of examples of young, otherwise healthy people who have also died of infection. And so while we know the patterns and likelihoods, we can't predict how any one person will come through infection. But when we look at it at a community level, we have a very different problem, which is that as individuals think of this as, how will I personally benefit? Do I personally need it? Do my kids need this vaccine? When we think of things outside the COVID context, it feels like the right way to make a decision. And the challenge is, when we come to infectious disease, your choices never stay within the individual, that we share risk at a community level every time we go to the grocery store, every time we send our kids to school, every time we visit an aging care facility, right? We share risk. And so those personal choices start to matter in how we move through the world together. And that's a very different way of talking about vaccines than we've done in the last several decades.
And Samantha, at some point this week, we're going to pass 2,000 deaths in the province of Ontario, presumably. If you look in the United States right now, I guess it was a week or two ago that they passed more deaths from COVID-19 than the number of soldiers who died in Vietnam, the number of American soldiers. How concerned are you that in spite of these, really quite appalling numbers, the numbers of people who are still very skeptical of taking any kind of vaccine when it becomes available is still so high?
I'm extremely concerned. I think it's a reflection of other conversations and other diseases that we are talking about when we talk about measles or polio making comebacks, and we worry about those things. Pertussis, whooping cough. COVID-19, what we know about it so far is still quite limited. We know it's dangerous. We know it spreads easily. We know that the R0, which is how easily transmissible it is, can be extremely high. And we know that our immune systems, as of now, haven't learned how to defend against it for most people. And so when we talk about what's going to happen over the next 3 months, we talk about a second wave of COVID, and that timing of that second wave looks like it'll be at around the same time as the influenza wave usually happens. We talk about all of those things. I worry what it means to patients. I worry what it means to our population. I worry what it means to our economic recovery if come October, November, we're right back here having these same discussions because we don't have the capacity to protect ourselves unless we work as a group, unless we work as a societal construct. And Jennifer was quite right when she was referencing that, especially in Canada, or rather, I can only speak to Canada because that's where I live and was raised. We are reasonably socialistic in nature, and we all have a social construct with each other. So there's autonomy and there's the principle of free choice, but there's also the responsibility that you have to your neighbors and your neighbors' parents and children. And sometimes that's really obvious. We all stop at red lights, for example. We do that because we know it's the safest way of getting through traffic. When it comes to vaccines, I really fear that the idea of that social construct gets lost in the messaging of personal choice. And when I get a vaccine, whether it's for COVID or influenza or for measles, it's not necessarily to protect me or to protect my 5-year-old or 2-year-old child. It's not to protect my elderly patients. It's to protect all of the patients that I come into contact with in the hospital. It's to protect that grocery clerk and their parents and their children. And that's the social construct that Canadians genuinely adhere to for the most part. And so when you hear about 20, 30% of people potentially not wanting to get this vaccine that could be life-saving for thousands, if not tens of thousands, it's frightening.
Well, Jennifer, I do want to ask you about pictures that I have no doubt many Canadians have seen from the United States that I suspect most Canadians find disquieting. And that was, of course, the large numbers of people protesting in the streets of, for example, Michigan or Minnesota, essentially saying we want to go back to work, not, well, at the very least, not practicing a kind of physical distancing that's been urged. And I don't want to say there's a comparable movement here in Canada, but we've seen some of it. And Chad, maybe I can get you to bring that picture up right now. Over the last few weekends, we have had demonstrations at our provincial legislature. I don't want to sound like a smart aleck here, but obviously there's no marks for spelling here. No more poison is not quite spelled correctly, but these are people who are not practicing physical distancing, whom the premier of the province called the other day a bunch of yahoos for not living safely and not practicing that physical distancing. I want to know, Jennifer, more about who these people are. What's the general demographic profile of a person who just doesn't believe any of this stuff, doesn't want the vaccines, and will come out and hold a protest sign against it all?
You know, it's complicated to know exactly like what the profile of this group is, but even prior to COVID in the US, we were having a lot of arguments and a lot of disagreement publicly about what is a fact, what are the roles of civil liberties versus community responsibility? How do we want the government to intervene, and when is the appropriate role of the government to take an action in daily life? And so we've been having these very rigorous debates, and I think a lot of that played out if you were watching in our 2016 elections. And so we were already primed in a lot of ways for civil unrest when there was government action. There aren't a lot of examples in recent history in the US of governors asking people to do something like stay at home and even threatening them with citations if they don't. We're seeing similar things as stores and businesses are asking people to wear face coverings or refusing to serve them. And that's also being met with a fair amount of anger, even though those are private actors, not state actors. And so in the US, and I think to some small degree, the way that we can see this playing out in much, I think, more reasonable and smaller scale ways in other places, you know, we have this core tension about how much individuals should be asked to sacrifice for the good of the community. And in the US, our unemployment numbers exceed those of the Great Depression right now, as of this week's job report. People are financially struggling. The US does not have a strong safety net of care for things like childcare and healthcare that are not tied to employment. We don't have a family allowance. And there's a lot of ways that people are feeling really insecure. And the continual ask to sacrifice by staying home, by not looking for work, or by moving through the world in ways that might not be entirely comfortable, are really playing out in these ways that are somewhat public. And again, it's a numerically small number of people, but it's a very vocal group that's really raising these kinds of questions.
And Timothy, you might have thought that education would be the big differentiator here, that the more education you have, the more likely you are to buy into the notion that vaccines will be helpful to you. But I have seen some research which suggests that it's sort of white, well-off, college-educated moms, I guess, for the most part, who are the backbone of this anti-vaccine movement. If that's true, why would that be the case?
You're right. And again, it's hard, you know, Jennifer would know this well too. It's hard to get good data on this. But for example, there was a study that found that 89%, I think it was 89% of the vaccine anti-vaxxers online are women. Another study published in the journal Vaccine I think it was 2019, found that over 60% had a household income of over $100,000. Over 40%, I believe, were college educated, which is larger than the percentage of the population. And I think 60% had at least some post-secondary education. So it's probably not the demographic that a lot of people, you know, expect. And they also, you know, are more likely to believe in alternative medicine. They're more likely to buy into the wellness culture. So there are some characteristics that are more common, but we have to again be careful to remember that this is a diverse group and everyone has different concerns associated with vaccines. And I do want to touch on the ideology thing. Again, it's hard to study this well. It's hard to get really good data on this. It's all correlation data, but there is some data that finds a correlation between the rise in anti-vaccination and the rise in sort of a populist ideology. And there was a really interesting study that came out from, I believe, Cambridge just last week or the week before that found, again, a correlation between a more of an individualistic ethos. No surprise here. No surprise. It backs up what everyone's been saying. But an individualistic ethos and concern about the lockdown, these lockdown protests. And that, fits very closely with what's been said also about, civil society, the role of government, and concern about vaccines.
In which case, Samantha, at some point in the next, who knows, year, 18 months, 24 months, we're going to have a vaccine. And governments are going to have to make a decision about whether or not it's optional or mandatory. What's your view on that? What should it be?
Well, I'm going to sidestep that question entirely and go back to the one that you asked before about relationships, or at least that's the way I phrased it in my head, was the answer to this is about relationships. Most of the people who are vaccine hesitant are not profoundly stringent anti-vaxxers, as we've said before. Most of the people who are vaccine hesitant are educated, concerned parents who need help making the right decision for their family and for their children. This will obviously affect people who aren't children, but as well. This is where physicians lead such an important role in healthcare and in public healthcare. The government can decide that it's mandatory. They can decide that it's not mandatory. And then trying to enforce that will be near impossible, as so many things are, to be honest. Are we going to refuse access to 30% of children back to school because they aren't COVID vaccinated? That'll be a really hard decision to make. And you have to balance social responsibilities to the children as well there. But the pediatricians who have long-standing relationships with those families, the family doctors who have long-standing relationships with those families, these are the people who can help the patients and their families make the right decision about getting the vaccine. And the truth is that not everyone will be able to get the vaccine and not everyone should get the vaccine. And so that's a decision that doctors are uniquely poised to help people make as they understand the pathophysiology of the vaccine, as they understand the patient itself state of health, and as they understand the risk to society. And that's actually one of my biggest concerns. I think I referenced this earlier, but I'm really worried about the current healthcare structure support that is in the periphery. We talk a lot about hospitals being the center and the backbone of healthcare, but when it comes to pandemics and crises like this, it's really community care that keeps patients out of hospital. It keeps all of these children and adults healthy and well. And right now, Ontario doctors are really struggling to maintain that on their own. And so we talk about the COVID vaccine coming out, and I wonder to myself, if we lose a third of our pediatricians and we lose a third of our family doctors out there in the periphery, who's going to have these conversations? Who's going to give these vaccines? Who's going to convince these patients who need that information, who need that extra 10 minutes of personal contact where you can acknowledge with empathy where someone is coming from. You can acknowledge their concerns and then lead them forward to a place where we can all be safely protected as a society.
I got to say, Dr. Samantha, as sidesteps go, that was expertly and elegantly done.
Well, I thank you. I tried.
Well done. But Timothy, no such luck for you. I want to know whether or not your advice to ministers of health across the country would be, this vaccine is mandatory. You cannot come back to work unless you can prove that you've had it. You cannot send your kids to school unless they can prove that they've had it. Should that be the approach?
Okay, I'm going to sidestep it, but in a different way.
When did I lose control here?
I don't like the phrase mandatory. And in fact, I think it really plays into the hands of the anti-vax community, because they can, a lot of their organizations are called choice, or it's about informed consent. And it really plays, who's against choice? Who's against informed consent? And liberty, that's another term that you'll see often used by that community, because it has an intuitive appeal. I am for evidence-based policies that are ethical, that encourage an uptake in vaccines. And so I know that sounds like a lot of Weasley words, but I think it's true. And look, mandatory vaccines, the way that you've described, a lot of jurisdictions have them. Ontario has them. You know, New Brunswick has that kind of policy where you have to prove that you've been vaccinated before you can go to school. California has a pretty aggressive policy. Italy has a very aggressive policy where if you don't get vaccinated, you might get fined. I think it's $500, euros, which is not insignificant. And there's some evidence to suggest that these policies work. In California, their more aggressive vaccination policy has increased uptake. There's some very recent research from Italy that suggests that their policy has increased uptake. But the problem there is, and so I think that we need to look at the evidence. The problem is that going to polarize the discourse further, right? Is that going to play into the hands of the anti-vax community to suggest that the government, is going to force you to get these vaccines? So I think we need to really careful what we mean by mandatory, what the policy actually looks like. In no liberal democracy are we going to have police show up at the door, force people to get vaccines. And that's often the way the anti-vax community wants to portray the idea of mandatory vaccines. No one is talking about that. Rather, they're talking about state policies that encourage the uptake of vaccines, and some of those can be pretty significant. Like, can you go to school, public health school, and do we really want to punish the kids who may not even be making this decision? So, lots to consider there. But I am pro evidence-based policy that are ethical and legally sound, that encourage the uptake of vaccines.
Jennifer, I'll convince to be. I will
Your
fess
third
up.
time.
Yeah, I'll fess up to being a little bit terrified to ask you the same question, lest I be sidestepped a third time.
I won't sidestep, I promise.
you want to take a shot at it? Go ahead.
Sure, I'll take a shot at it. I think it's a really interesting question. So one of the things that happens when vaccines become recommended is that there's usually some scaling of where does this vaccine work the best, who most needs protection at which ages, and then how does it work in combination with other vaccines in the schedule. And I was pretty impressed in my research with and interviewing vaccine researchers to learn that committees look at something like 800 interactional studies of how any one vaccine works in concert with other vaccines. And it turns out some vaccines actually are more effective and build better immunity when given in combination. And I think that's not well communicated to consumers, and that's a mistake. In terms of thinking about a COVID vaccine, we have to have some, I think, a little more information about the disease trajectory. And I was just reminding some folks yesterday that we've only really been talking about this for less than 4 months. And so we don't yet know a lot about this disease. And it feels like, well, why don't we know more? We've been living with it forever. And I think that social distancing has changed our perceptions of time. But it's worth remembering that in the early days of polio, we also did not know very much about contagion. And it took a while to figure out how a virus works and where it matters and what the stages are after infection. And it's going to take us more than 4 months to know what the story is with this virus as well. Having said that, once we understand more and we already have some indications about the patterns of who seems to be the most affected, we're going to have to make policy choices then about how to give out a vaccine, what the priority should be, because interestingly, as much as we're talking about, convincing people to take it, we also know from things like the licensing of the polio vaccine that there's never adequate supply in the first year of a new vaccine for how many people want it. And so there's going to have to be decisions also made about who's a priority for this. My fear is that if those are handled badly, and if there's not good communication with the public about how those choices are being made, who is making them, and with which incentives, we run the risk of damaging trust in all vaccines and further undermining the vaccines we already have that we know are safe and effective and important. And in some ways, the drop in things like MMR vaccines in children right now indicates that might be a real possibility. If we decide this is a vaccine where the priority is really for adults, and we know adults are much more likely to be hospitalized and to die of this virus, we don't have any system of enforcement that exists for adult vaccines outside of workplaces. And that's going to be a much harder conversation. So we already have examples of things like influenza vaccines that are required for healthcare workers. And they're required often for employees at senior centers and long-term care facilities, because we expect that that workforce works with people who are medically vulnerable and should not increase the risk to them by working there. And there are several hospitals that will dismiss nurses who refuse to be vaccinated or require them to have notations on their badges that are publicly observable or to wear a mask for the entire of influenza season, or will reassign their work. The same can be true for custodial workers, cafeteria workers. During flu season, we've had longstanding policies at sort of the employment level. With COVID, we're going to have, I think, very hard community conversations then about what are essential workers, who presents risks to others, and then also are those workers' priorities for receiving protection, since they, even as grocery store workers, as delivery workers, as frontline workers, are putting themselves in face of the public to make sure people have what they need every day, and what's the public responsibility to protect those folks too. And those may not be legislative processes, but those are absolutely going to need to be policy conversations that bring in key stakeholders, that bring in community members. And I would say, particularly in the US context where we have a lot more distrust of our government, those are going to have to be entirely transparent to build any consensus around a vaccine policy.
That's our time. I want to thank you three very much for coming on to TVO tonight and helping us out with this. Be safe, everybody, and thank you.
Thanks.
Thank you.
Thanks.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.